My name is Dr. Jason Zauls. I'm a radiation oncologist at the Good Samaritan Medical Center. I am also the Cancer Program Medical Director. Currently, we're sitting in the linear accelerator room within the Radiation Oncology Department, and behind me sits the linear accelerator that we use on a daily basis to treat women with breast cancer. So every woman who comes in the Good Samaritan Medical Center with breast cancer is discussed at our multidisciplinary tumor board. At that tumor board is where you have a bunch of specialists meet. A lot of times this woman hasn't met all these specialists. But there's probably at least 5 different doctors who look at each case individually and together and collaborate to come up with the best treatment plan. This includes the mammographer. This is the doctor who looks at the breast tissue through the mammogram. This includes the pathologist who looks at the breast tissue once it's been removed from the breast and looks at it underneath the microscope to determine how aggressive the cancer is. This includes the surgeon who removes the cancer from the body, as well as includes the medical oncologist who delivers either chemotherapy or other types of endocrine therapy, and a radiation oncologist like myself who treats cancers with radiation. So the way radiation therapy works is a patient, and if a woman comes into my breast center, she'll lay down on the table right here. There's the radiation machine sitting behind me. That radiation machine will deliver photon beams of energy. We usually use 2 beams of energy going through the breast tissue itself. When the photons of radiation go through the breast, it affects both cancer cells as well as healthy cells. When we look at these cells underneath the microscope, what happens is all cells, they have a checkpoint. And what they do is that checkpoint tells them whether they can divide and grow or whether they should stop, look around to see if there's any damage to them, and halt anything and repair themselves. When normal tissue of the body, normal cells of the body is hit with radiation therapy, the cells are smart. They stop themselves in their track, and they look around and say, hey, there's damage to us. And what they then do is then repair themselves. And once they double check their repair, make sure everything's okay, they know it's okay to divide and grow. For a cancer cell, it's quite the opposite. What they want to do is just continue to divide, not being tethered by any checkpoints. So when the radiation hits the cancer cell and it damages the DNA, these cancer cells aren't smart enough now to say, hey, there's something wrong here, let's stop them, let's fix it. So what they do is they just go right by that checkpoint where they're supposed to stop themselves and look around and fix it. They go right by that checkpoint, continue to divide, and when they continue to divide and try to grow, that's when the radiation kills them. The Good Samaritan Medical Center has been awarded the Outstanding Achievement Award in the Commission on Cancer. This is given to the top 15% of hospitals nationally.